looks like Dr. Smith has given us a new order to place an NG tube in Mr. Johnson. So confirming his order and verifying it with the patient. We have our equipment gathered and everything is collected. We will go and see Mr. Johnson. Hi, Mr. Johnson. My name is Colin. So Dr. Smith has given us a new order to place an NG tube in your nose. Do you mind verifying your name and date of birth while I check your armband? Okay, great. So I perform hand hygiene, washing my hands, and placing new gloves on. All right, Mr. Johnson, I'm going to sit you up into a high Fowler's position so that you're able to sit up well and tolerate this good. I have a cup of water here too for you so that you can sip on this while we're doing it. I told you earlier this is what's going to help you help the tube go down whenever we're doing it. But first I need to check your nose. Can you blow through your nose? And blow through your nose, just normal. Thank you. Making sure that we're all patent and it's good and clear. All right, next we're going to measure the tube against your nose, from the nose to the top of the earlobe, and then from the earlobe down to the xiphoid process. So we have got it marked right here. I will take a small piece of tape. There we go. So it doesn't go any further than that. All right, Mr. Johnson, I'm going to lubricate this tube just a little bit, and you have your cup of water here with you, so take sips of water while this is going down, okay? We're going to insert in the right nair, and take sip, 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 sip. Almost done, and we're there. Okay, I'm going to take this other piece of tape, and we're going to temporarily secure this in while we wait for the x-ray team to come in and snap a picture and see where we're at. In the meantime, I'm going to take a small bit of sample, pull back, get any secretion. We do have some gastric contents, so we're going to push this in here, reclamp. I'm going to test the contents and compare to make sure we're at the right pH level. Looks like it is. Oh, x-ray's here. X-ray's been confirmed. This is the correct placement for it. So Dr. Smith has not given us any additional orders as far as suctioning goes, so we're going to leave you clamped off, so no suction right now. We'll wait further orders from him. I'm going to secure this tube down just a little bit more permanently so it doesn't go wiggling anywhere. And this would be anchored down to the cheek or at the chest, away from you. All right, and at this point we are done. So I will do hand hygiene, wash my hands again, document the location that the tube was placed, which was the right nair. We used a 16 gauge, 16 French tube placement, the contents of the stomach, what was seen, pH level and how it was confirmed, and of course how Mr. Johnson tolerated it, which was well. So, and that is it. Thank you. Hi, in this section of the video and checkoff, I will be performing a enteral nutrition feeding via nasogastric tube simulation. So to begin with, I would verify my order that my physician has given me for my patient. My patient's confirmed, the identification's confirmed, I've checked for allergies, and I have verified that this is the feeding that the physician wants and the amount that the physician wants. Okay, next I would enter into the patient's room, introduce myself. Hi, hello, I need to do a feeding. Do you mind verifying your name and date of birth? Great. And then I would begin by performing hand hygiene, donning a clean pair of gloves, and preparing my station. I would prepare my feeding bag that the nutrition would go into, while shaking the container to make sure it is all dissolved and not settled, opening the container and pouring into the feeding bag, making sure that it is primed and stopped so that it's not flowing out into the floor. I'll do that. Once that is complete, I'm ready to set my patient into a high Fowler's position so that they can not aspirate on any of their feeding. So we want them sitting up. And I would verify placement of the patient's NG tube by using a piston taking the gastric tube, opening up, and pulling back for any gastric contents. If anything greater than, so this is the maximum that I have received back, I'm going to cap it, place it into my container, test with pH strip, confirming that it is in the correct location, that it is gastric contents, and it is less than 100 mLs, so that would be appropriate to replace back into the gastric tube. And to do so, I would begin by placing the tube and pouring the contents back into the gastric tube, making sure that my tube is open and it is flowing into the patient's stomach. Okay, once it has been placed, I would make sure that I am flushing the stomach with 30 mLs of water. So I make sure it's 30 mLs. Once that has been placed, the testing portion of this is done. We would simply connect the tubing that has already been primed to allow for gravity flow. So tubing has been connected. I can start my machine if it was running on a continuous pump. If it was not, I would open it up and allow for gravity to flow and allow it to flow for the desired amount of time or until the contents was completed to finish the order. I would make sure that I'm checking residual every 4 to 6 hours to make sure that the patient has not, that the patient is digesting appropriately. If I did have greater than 500 mLs in the beginning, I would wait 1 hour, check again, and reassess, and if it was still continuously greater than 500, I would hold that feeding and not administer it. I would notify the physician at that point. Making sure that I date my bag so that my bag is changed every 24 hours, not to allow it to be reused for more than that. And once my feeding is complete, it is done, we will attach my piston once again, detaching my tube once it's completed and cut off, attaching my tube, and flushing once again with 30 mLs of water to make sure that my line is clear and does not get clogged. Once it's inserted and it's completed, my piston is able to go down and I can recap my NG tube. Once my NG tube has been capped, my procedure has been completed. I'll make sure that all my supplies was out of the way and cleaned up. I would discard my gloves and perform hand hygiene again. Once this was done, I would document the procedure and how the patient